This spotlight on employee benefits is sponsored by AFLAC, providing a safety net for families. Get started with AFLAC today and visit aflac.com/brokers. The Obama administration is appealing U.S. District Judge Roger Vinson's ruling that found the health care law unconstitutional. The Justice Department filed a notice of appeal on Tuesday, sending the case to the Court of Appeals for the 11th Circuit based in Atlanta. Last week, Vinson placed a stay on his own decision after the administration asked him to clarify whether states must continue efforts to implement the law. However, Vinson ordered the administration to file its appeal by Thursday and seek a fast-track review. The case, brought by 26 states and the National Federation of Independent Business, challenged the health reform law's requirement that all individuals obtain insurance by 2014. Vinson ruled in favor of the plaintiffs, finding the individual mandate unconstitutional. In addition, he said the mandate is key to the law's ability to function, thereby striking down the entire health reform law. Vinson's ruling is the second to find the law unconstitutional. 3 other federal judges have ruled in favor of the law. The Supreme Court is expected to have final say on the law. A study examining the effects of health reform in Massachusetts finds health reform does not reduce the number of medical bankruptcies. The state's recent healthcare reform served as a model for the federal healthcare reform law. Researchers say while more Massachusetts residents have coverage under the law, many are still struggling with medical debt. A survey of Massachusetts residents who filed for bankruptcy in July 2009 shows 53% attribute medical bills to their bankruptcy, compared to 59% in 2007, before the health reform law was fully implemented. However, because of the small sample size, researchers say the difference is not statistically significant. In order to reduce medical bankruptcies, coverage will not only need to be expanded to more individuals, it will need to be greatly improved, according to the researchers. Republicans on the Energy and Commerce Committee want to subject 5 provisions of health care reform to annual appropriations so they can defund them. The Hill obtained a memo outlining the 5 provisions Republicans want to make discretionary. In addition, the memo says the Health Subcommittee plans to hold a hearing to address the issue. The 5 provisions targeted are grants for state-run health insurance exchanges, a $17.75 billion prevention and public health fund, a $200 million construction and capital cost fund for school health centers, $75 million per year through 2014 in state grants for sexual education for adolescents, and $230 million in grants for primary care residency programs and teaching health centers. The healthcare law is unusual, according to the memo, because it, quote, provided mandatory spending for numerous newly created or established programs that would be normally considered discretionary in nature, unquote. For more industry spotlights, visit producersweb.com.